If you miss atrial fibrillation on an ECG, you may miss the chance to prevent a stroke. In this video, I will show you how to identify atrial fibrillation on ECG in under 30 seconds. Atrial fibrillation, or AF, is one of the most common and most dangerous arrhythmias seen in emergency and clinical practice. But the good news is this: atrial fibrillation is actually very easy to recognize if you follow a simple step-by-step approach. Let's start. Atrial fibrillation is chaotic electrical activity in the atria. Instead of one organized impulse coming from the SA node, there are hundreds of tiny electrical impulses firing randomly in the atria. Because of this, the atria do not contract effectively, and this is the main reason why P waves disappear on the ECG. The first thing you should always check on an ECG is the rhythm. In atrial fibrillation, the rhythm is irregularly irregular. This means there is no repeating pattern and no predictable spacing between the R waves. If the RR intervals are completely uneven, this should immediately make you think of atrial fibrillation. Now look carefully at the baseline. In atrial fibrillation, normal P waves are absent. Instead of clear P waves, the baseline looks chaotic, wavy, or fibrillatory. This happens because there is no organized atrial depolarization. If you cannot clearly identify P waves before each QRS complex, suspect atrial fibrillation. Next, look at the QRS complexes. In most cases of atrial fibrillation, the QRS complexes are narrow. This tells us that ventricular conduction is normal, and the problem is above the AV node. A wide QRS does not rule out atrial fibrillation, but a narrow QRS is more common. Now put everything together. If the rhythm is irregularly irregular, P waves are absent, and QRS complexes are usually narrow, the diagnosis is atrial fibrillation until proven otherwise. You do not need complicated calculations. Pattern recognition is the key. Atrial fibrillation is not just an ECG finding. Because the atria do not contract properly, blood can pool inside the atria and form clots. These clots can travel to the brain and cause an ischemic stroke. Atrial fibrillation increases the risk of stroke by about 5 times. That is why early recognition matters. Here is a simple rule to remember. If the rhythm is irregular and P waves are missing, assume atrial fibrillation until proven otherwise. This single rule will help you in exams and in real emergency situations. In the next video, I will show you how to differentiate atrial fibrillation from atrial flutter on ECG in seconds. If this video helped you, make sure to subscribe to the channel for clear and practical ECG explanations.